Hey everyone, and welcome back to the channel. Today, we're diving into a super important medication called Vasopressin. We'll break down what it is, how it works, what it's used for, and everything else you need to know in a simple, easy to understand way. So grab your notebooks and let's get started. What is Vasopressin? First things first, what exactly is Vasopressin? Well, it's a powerful drug that acts as an antidiuretic. Think of it as a water-saving superhero for your kidneys. It helps your body hold onto water by telling your kidneys not to excrete too much of it as urine. This is why it's also sometimes called an antidiuretic hormone, or ADH. How does it work? The mechanism of action. Now let's get into the nitty-gritty of how this drug performs its magic. It's a chain reaction that happens inside your body, and it's all about increasing something called cyclic adenosine monophosphate, or CAMP for short. Step 1. Vasopressin enters the scene and triggers an increase in CAMP. Step 2. This rise in CAMP acts as a signal telling the renal tubules in your kidneys to become more permeable to water. Think of it like opening up little floodgates. Step 3. With these floodgates open, the kidneys reabsorb more water back into your bloodstream instead of letting it go into your bladder. Step 4. The end result? Your body produces a decreased volume of urine. Less water is lost, which is exactly what we want in certain medical situations. What is vasopressin used for? Indications. Vasopressin has a few key uses in medicine. It's not a general-purpose drug. It's used for very specific conditions. Diabetes insipidus. This is a condition where your body doesn't produce enough of its own antidiuretic hormone, causing you to urinate excessively. Vasopressin helps replace what's missing. Variceal hemorrhage. This is a serious internal bleeding from swollen veins in your esophagus. Vasopressin helps to constrict the blood vessels, slowing down or stopping the bleeding. Pulseless arrest. In emergency situations where someone's heart has stopped, vasopressin can be used as a last resort to help increase blood pressure and improve circulation. Vasodilatory shock, or septic shock. When a patient is in shock and their blood vessels are dangerously relaxed or dilated, vasopressin can help constrict them and bring their blood pressure back up. When should it be avoided? Contraindications and precautions. While vasopressin is a lifesaver in certain situations, it's not for everyone. Doctors need to be very careful when prescribing it. Contraindications. These are situations where the drug should not be used at all. Hypersensitivity. If a patient is allergic to vasopressin. Coronary artery disease. Because it constricts blood vessels, it can put a strain on the heart. Chronic nephritis. This is a long-term kidney inflammation, and using vasopressin could make the condition worse. Precautions. These are situations where the drug should be used with caution. Patients with a history of heart failure, migraine, epilepsy, asthma, or hypertension. Patients with renal impairment, kidney issues. During pregnancy and lactation. Side effects, or adverse drug reactions. Just like any medication, vasopressin can cause side effects. If you or someone you know was on this medication, it's important to be aware of these. Common side effects: nausea, vomiting, headache, sweating, and skin rashes. More serious side effects: chest pain, arrhythmia, or irregular heartbeat, and fluid retention. You might also notice pallor, or pale skin, or abdominal cramps. A very important one to watch out for is hyponatremia, which is a dangerously low level of sodium in the blood. This can happen because the drug causes your body to retain too much water, diluting the sodium. How is it given? Dose and route. Vasopressin is a powerful medication, so it's only available from a healthcare professional and is given in a very controlled way. Dose for diabetes insipidus is usually given as an injection under the skin, SC, or into a muscle, IM, with a dose of 5 to 20 units every 4 hours. For variceal hemorrhage, for this, it's given as an IV infusion, which means it's slowly dripped into a vein over about 15 minutes. The usual dose is 20 units. It's available as an injection and infusion and can be given via SC, IV, or IM routes. So there you have it, guys, a full breakdown of the medication Vasopressin. I hope this lesson was helpful and easy to follow. Don't forget to hit that like button and subscribe for more medical deep dives. See you in the next video.